public trust in healthcare professionals has eroded. I don't believe there's an argument about that. But how significant of an issue is it in 2025? That's the question, Eric.
Yeah, I mean, I think that staffing shortages still remain as one of the biggest existential threats to healthcare. Um, you hit, not only do we have retirements and burnouts, but we're not getting clinicians into the workforce fast enough. And to add, nurses and physicians are now unionizing at rates that we've never seen before. I think that, will push for policy changes. It'll push for technology adoption. I think when we get to the technology region, we'll be talking a lot about addressing burnout. I expect, and that's because of this workforce cliff, or that's a contributor to the workforce cliff. The workforce crisis to me is kind of like a team running out of scholarship players. If you don't fix that, nothing else matters.
Yeah.
I think you're right that, COVID showed us the dangers of misinformation. But I think, in this case, the workforce crisis has clear and immediate consequences.
Leah, it feels like we've got in 24 in particular, we've got a growing level of skepticism around the implications of artificial or augmented intelligence, and we'll talk about that seed certainly later, but the efficacy of digital health tools, despite the rampant nature of their implementation. Are they really impacting the way that we deliver care? Do employers have too many of those that they're deploying across their workforce? How consumers interact with data-driven healthcare decisions, or maybe said a little differently, where they get the data and how they deploy that data in making their healthcare choices is something I know that you and your team spend a lot of time thinking about. But is it enough to question our healthcare choices, particularly in a year where we've got a workforce cliff that we're working even more significantly towards as a trend of such weight?
Well, I think that the rise of misinformation, I guess I would call that the problem of trust. There was very little trust by the American public in the healthcare system. And we're seeing that erode every day. There's a sense that I know better than my doctor, or I know better, or they're not telling me certain things deliberately. And out of that comes some of the what I would call conspiracy theories that are coming out of even from Secretary Kennedy in his past. We're seeing just the rise of lots and lots of mythology about how the healthcare system has functioned, and COVID actually contributed to that. And not only because people made up things about just aspects of how to treat COVID or how to prevent it, but also because there was some misinformation from public health authorities, and that probably did a lot of damage as well. So we have seen the rise of misinformation. It is a problem, and it really has driven a lot of what happened in the last election even. So I do think that that's a big issue, and it's one we watch really closely. That said, though, I think the workforce cliff for this year is going to be even bigger issue right now. Partly because when we think of workforce, it's not only physicians and nurses, it's everyone who works. It's the housekeeping, it's environmental, it's everybody who works in a healthcare system. And I think we're going to have a lot of issues with workforce in general in our culture, and we already have major challenges in healthcare. That is going to be, I think, accentuated as we see. Well, for instance, in healthcare, one avenue that providers have turned to in order to address this workforce challenge is recruiting internationally. And that is going to be much, much more difficult under this administration. I think with the immigration issues that we're seeing are going to have a lot of impact on access to workers, whether within health systems or just or elsewhere. So I do think the workforce issue is going to grow exponentially this year, and it's going to be a major issue. So I'm that's my team.
David?
This is such a really fascinating matchup. In some ways, both are obviously real. The rise of misinformation is a little bit more insidious, whereas the workforce kind of shortage is in your face. Um, that said, the solution for both of these problems may be the new LLM models of AI. Um, it's interesting. Normally, when we apply technology into healthcare, we have to add people. Uh,
Mm-hmm.
it'll be interesting to see if this wave of technology innovations will allow us to not add people or to replace people or to enable non-traditional forces in healthcare delivery, like a health coach, to be more impactful. I also think in an age of misinformation, people will increasingly look for their own information because, and frankly, maybe self-care should have made the tournament because I think when you don't have access to providers and you're not sure about the information and you increasingly can arm yourself with your own information,
Yeah.
the notion of self-care becomes pretty compelling. So I do think we are at a point now where patients using access to Gemini or ChatGPT 4.0 actually will approach their doctor's office actually knowing more than their doctor. And I think that reckoning of that reality. I mean, I remember when I was in practicing patients and people, first had access to Google search, it was annoying because people came in with their own
WebMD. Yeah.
with their own thoughts about what they had, and it was way off the mark. But with these current compute models, you can get very precise, and
Yeah.
in many cases, can get the right answer. I've just done my own kind of playing around with it, and it's really remarkable how sophisticated these tools are at really getting to really unique diagnosis. So this is a really interesting matchup. I think technology is these are two use cases for AI and technology. I'll reserve my vote until the paddles come up.